Since the inception of this program, says has successfully diverted 87% of the kids away from Baker Act. So, of all the calls we've done since 2015, 87% of those kids have not been Baker Acted. And prior to these programs, almost all of them would have been Baker Acted. So, you look at that. I don't have the number here in front of me, but I calculated it at one point. It was like hours of trauma that kids had avoided by not being in a Baker Act facility. That's just huge, and that's probably where we need to look first. You think about the kids first. We're always off on a good foot. If you look at that just from the taxpayer perspective, those Baker Acts are generally going to be Medicaid funded, probably 9 times out of 10. Here in our area, at least, they're $3,900 a pop. So for that 72 hours, assuming you don't stay even longer, almost a $4,000 charge that we, the taxpayers, would have been paying for that service. And when you look at it that way, just last year, the mobile response team did 400 youth. A few of those may have been repeat calls. Let's just say 400 youth times that 87%. You take that number of youth times $3,900, and it comes out to around the neighborhood of like $1.4 million in terms of your return on investment. And again, that's just that one problem. That doesn't take into account our community action team, C.A.P.E for short, and the coaches team that Dennis mentioned. We're saving the community millions of dollars by serving these kids out in the community in the least intrusive way possible and at a way that's less expensive than the DJJ programs, traditional foster care, therapeutic foster care, or a Baker Act, all of which have a higher cost per day than the programs that we're offering in the community. Again, it really all to me goes back to how much trauma can we save these kids when they don't have to get in a police car because the police will put them in handcuffs every time. They were required to do that, at least until here just recently. I think they have some discretion, but they're still usually going to go in handcuffs. And the back of a police car with a radio blaring and a person in a uniform with a gun and a taser on their side. So being able to save the kids, all of that is huge in my book. And the people that are more fiscally concerned, we're also saving the community a lot of money.
Would it be fair that's part of the reason you guys began in 2015 in the first place is these crises would occur and teams would go out there that either weren't prepared to handle it or they just handled it with resources they had on site, potentially leading to these things escalating and causing trauma. And like you said, even more costs to the taxpayer on the back end as well.
Yeah, most of it was law enforcement handling the calls then. I don't think there were a lot of crisis response teams even in place until the state decided. And it wasn't just in our area. It was across the entire states. Baker acted for kids anywhere as young as 5 years old, or Baker Acts for kids as young as 5 years old were just exploding. And it was a discussion throughout the state and in the legislature and everywhere else with law enforcement. So started putting their heads together to try to come up with something to work. And every area in Florida now has a mobile response team, but they don't all operate the same. They aren't all 24/7. We didn't start out 24/7, but we are now. We even had a staff go out during the hurricane evacuation last year. Our staff stays in the shelter. And so has it, but that's definitely why it started, was just the explosion in Baker Acts and how traumatic those are for our kids.
Hey, Curtis, I wanted to add to that too, like law enforcement, like Tim was saying, that was one of the things when we first developed this program. We had to really work closely with the school district for one, and then law enforcement. They have a crisis intervention training that they do, and there's a youth mental health component to that. So they would come on our campus and learn about mental health and that sort of thing. But the consensus was, St. Johns County Sheriff's Office, the experts in enforcing the law, and they looked at the mobile response team clinicians as the experts in mental health. So they would default to the experts in mental health during that kind of crisis situation. And so we worked really well when we would respond to calls, and they would default to the crisis team to be able to handle those situations.
And now they actually have a co-responding team of mental health trained officers who are therapists as well. And so we'll co-respond to a lot of calls. And so if it gets really unsafe, there to handle that. That's not what our staff are trained for any kind of physical altercations. But if there's any way that they can allow us to resolve that situation without Baker acting a child or putting them in a police car, they're all in. We have a fantastic relationship with the sheriff's office.
So let's talk about that. This is all across the state of Florida, but it appears at least the awareness from county to county can vary. So I just want to clarify a couple areas. If there's a crisis at a school versus a parent is having at a home versus if there's at a rec center, what are the differences, if any, on how your team would get involved with those different areas of where the crisis takes place?
Well, the calls will come in a couple of different ways. That there is a hotline number we have, and when someone calls the hotline number, it will ask them to choose. They're 25 and under, the call gets routed to St. Augustine Youth Services. They're 26 and over, it gets routed to EPIC Behavioral Health. The number varies from each county, and there is through the Department of Children, My Florida Families Department of Children website. There is a section there for mobile response teams in Florida. You'll see it lists 50 plus teams there, and it does have by county the phone number that you can call to get access to the team. And our hotline number is on there as well.
The whole goal is to provide that immediate supports and then reduce the Baker Act, as long as
yes,
some situations I imagine might have to happen, but ideally we want to reduce the likelihood that does occur. And then after that, there is some sort of supports put in place or some person that's helping them prevent reoccurrences of what occurred?
That's correct. Yeah, we'll have one of our case managers will contact every person that makes a call to the hotline to do a follow-up to see if there are any other services needed or any other type of services that we can provide. Our team can also provide stopgap type therapy services if needed, for example.
Wow.
And just a frame of reference for you guys, numbers in terms of the volume of calls. Fiscal year was 399 calls. The year prior to that was 480.
What are some potential misconceptions or myths around this area that we might want to dispel now for our viewers?
The one thing that I faced throughout my career, and I've worked in now where I'm at in fundraising, but I've worked in a lot of direct care and case management in the dependency system is going to be one of those things where you come pick up my kid and fix them and bring them back.
Yeah.
That's not really how it works. Work with the community or with the family in a holistic nature. So we're going to work with mom and dad and how they're relating to the youth. We're going to work with the kids and how they're relating to mom and dad. Situational thing where the parents are out of work and struggling to make ends meet. So they're coming home and taking that stress out on the kids. And so, try to help families find work, get training, get their license, whatever it may be. But we're looking at the family, kind of like you talked about wraparound, and we practice the high fidelity wraparound model here. So it's nothing about me without me. So we work with the whole family to try to get everybody in a better place so that they're stable once we're gone.
Can talk to us a little bit about your funding stream. Where do you get your funding? How does this thing exist? Where is it coming from?
So primarily it does come from the state, from the Department of Children and Families, and make that available. In each region, there is called a managing entity that handles all of that money. And from there, they're able to identify providers to be able to provide the service.
Yeah, as a general rule, our programs are all underfunded. You talk about those institutional funders, LSF, DCF, whatnot. Since a couple of years ago, they asked us to expand a couple of our teams, and we did. So added additional case managers, therapists, peer supports, and then that money wasn't recurring the next year. Mm-hmm. So, for example, we started out probably $250,000 or more, depending on the program, underfunded for each of our 3 community programs, and we can't cross borders with the money. So we can't use MRT money to support coaches if MRT happens to be flush. And so the rest of that money comes really from private donors, foundations, whoever we in the fund department can find to support our work. And that's the struggle with that, is a lot of times people assume because we receive state funds that we're just fully flush with money and we don't have to worry about it and people don't need our support, but we can't survive without public support. Tune of probably close to $1 million a year, that when we have shortages in MRT or coaches or CAT, we don't have to lay those staff off. We can fill those blanks with the fundraising money.
Yeah, and I think this is a good example of one of those services that when people don't necessarily hear about it a lot, that means it's working, but that doesn't mean that it's not needed and it shouldn't be talked about. And when you talk about sending professionals that truly care about the nuance of a crisis, as opposed to just responding to that surface level behavior and potentially escalating it, I can't see any reason why something like this shouldn't exist and why it shouldn't be continued to exist and be continued to be funded and supported.